Now we are moving on to our next speaker, Dr. Amrit Nanaya, a highly qualified medical professional specializing in general medicine, diabetes, and palliative care. He holds an MBBS from KS Hegde Academy, MD from JSS, and there is so much more to his academic and professional qualifications. But one thing that really struck me in when one of the founders introduced me to him is the fact that he is one of the visionaries who stayed back to uplift the health and well-being of the people who of his native. I was told that he had opportunities to go abroad because he came with a lot of celebrated achievements, but still took the hard decision, and not I wouldn't say the more visionary decision to stay back and become the MD of Lopamudra Hospitals together with his family. They are managing. They are all doctors, and he has also held academic positions and has numerous publications, including clinical trials. So, in this session, Dr. Nanaya will explore the intersection of stress and diabetes, particularly among men in corporates. He will discuss how stress affects diabetes management and also provide optimal health strategies to ensure that we are striking a good balance, because more often than leading a healthy life, it is leading a life with stress management that is more important, because stress is an indispensable part of our daily life. So with that, I could not go more into his academic laurels. It's a long page. So with that, I introduce Dr. Amrit. Dr. Amrit, it's over to you. Please.
Thank you, Isaac, for those kind words, and I'd like to thank the Elohara team for taking up an initiative and putting up this platform. Yeah, so today I'll be talking briefly regarding stress and diabetes with special focus in men. So, like as Mr. Isaac has already introduced me, I specialize in diabetes and I have a postdoctoral in diabetes. I work with a lot of endocrine patients, and my background is basically general medicine. So here, without wasting any time, let us dwell into the topic. I would like to talk briefly regarding stress, and then I will be giving insight regarding what diabetes is and how it affects men. And then we will be trying to establish what is the link between these two. And then, we will sum up saying that what are the measures we could do to prevent, how we could reduce the stress where we could have better diabetic outcomes in men. So if we are actually looking at the definition of stress, this is the WHO definition, what I've taken, like stress can be defined as a state of worry or mental tension. So if you look at the definition, it says stress can be defined. It doesn't say stress is defined. So this is one of the definitions of stress, where or worry or mental tension caused by a difficult situation. So stress is a natural human response that prompts us to address challenges and threats in our lives. Everyone experiences stresses at some degree. The way we respond to stress, however, makes a big difference in our overall well-being. Now, this is just a definition. This is one of the definitions. Now, we'll have to look and try to understand what this definition is. No, so I always found very difficult to, because in medicine, when we say define, it's always you have to get those. It's more like a mugging thing, and you'll have to reproduce it in your exams to get the right amount of marks. So let us look into what actually they mean by stress, or what is the underlying factors, and what is how do you deal with it. So when you look at stress is nothing but a normal physiological response to a challenging or demanding situation. So when the humans evolved, or any species on the planet evolved, there is always a survival instinct. No, so whenever your placed in a position of challenge, like kind of, or whenever you are in a life-threatening situation, like kind of there is a response, there is a hormonal response, there is an endocrine response. So there is, all of you would have heard of this flight and fight mechanism. So flight and fight mechanism is nothing but a survival instinct which is present in every species in this planet because of for species survival. So what I want to say is, like kind of, for example, in the wild, if you have a deer and if you have a lion, the lion is trying to catch the deer. So like now there is a stress response in both. The deer will have to run for its life and the lion will have to run behind it for its food. So no matter you're a lion or a deer, no, you have to run. So in both, this response is triggered. There is a fight and flight mechanism in both. Either you will flee or you'll stand up and fight. So in humans, what has happened is, whenever you have the stress response, now what happens in the species? There is an adrenaline rush, there is a cortisol surge. So there is a lot of energy expenditure. What like when the animal is running, or like when it is fleeing or when it is fighting, all this energy burst which has happened, it gets dissipated. Now either you survive, so by the time you ran and like kind of you escaped, or you fought and you won, like kind of all this energy burst is like kind of taken care of, and this hormones comes down to normal. But we are in a situation that if someone shouts at you, you're angry, but because of the social circumstances, you can neither fight nor there is a flight mechanism. So you'll have to listen silently to all that rubbish, and you'll have to just keep quiet and no. So all this built up unutilized energy is nothing but stress. Okay, so I hope you have understanding as to what stress is. Now, why, like I'm not trying to tell you stress is only specific to men. It is, stress is a physiological phenomenon which is noted in all species. Now it is like, how do you cope up with it, and why is stress more common? Because our focus is on men, let us stick to men now. So here what happens is, like kind of Wing Commander has already told us about the work pressures, the long demanding hours, what the corporate world demands. Like obviously we know finance is like kind of the key thing. No, everyone wants money for the lifestyle what we have already set up to maintain that lifestyle. There is a financial stress, relationship, no, like kind of most of the, see, with changing generation, I think these relationship issues have become common. See, all of us, or possibly if we are looking at one generation before us, we all looked at the fathers as the breadwinners and the mothers were homemakers. And then like kind of we saw our fathers, we saw our mothers, and then we grew up in a certain way. But like now we realize that is not the thing. The father is no longer the sole breadwinner, neither the mother is the sole homemaker. There is always like kind of, no, any sensible person, for a sensible relationship to work, we know we have to split responsibilities, and like kind of there is no you do that, I do that, like it's like kind of we do it. So only when you do that, you have a healthy relationship. And I think smart men would have already realized it. If you're not smart enough, I think it's a really sad situation, because the relationship mostly very unlikely for it to work if you have a very smart working woman. So health concerns is definitely yes. So what happens is, men often like kind of, because we are busy and like kind of, not that like, no, now whenever we talk about men, we are talking about the traditional men here, but like no, already it has been addressed that no longer like kind of we cannot tell that man is the breadwinner and the woman is the homemaker. So like kind of, but generally what happens is we tend to neglect these small health issues until and unless it is a serious health hazard and which is requiring additional help. Now what happens, and like how is this the stress, and how can it affect a person? So if you're talking about men especially, we have physical effects, we have mental ill effects, and then there are long-term consequences. So if you are generally looking at a person, like kind of the physical manifestations could be very non-specific. The patient could have just headache, fatigue, chronic fatigue syndromes, muscle aches. They could have digestive problems, indigestion, recurrent going to bathrooms. So all these irritable bowel, all these diseases like fibromyalgia, they've got a very strong association with stress. So what I want to tell you is, like, though we cannot see stress, right? Stress is something which cannot be seen, but stress has a physical manifestation. Like someone can have a chronic headache, like kind of we call it as a tension type headache. Even I do whatever CT scan, MRI, all possible blood investigation, I'm not going to find anything abnormal. So these are called functional disorders. When we talk about functional disorders, you do not find the underlying organic pathology there. But then stress plays a very, very important role. When you're talking about mental health, like kind of we all know, you could lead to anxiety, depression, there could be difficulty in concentration, the patient could be irritable, sleep problems can no kind of arise, and then obviously to cope up with all this stress, no, like kind of substance abuse is something which is very common in men when compared to women, like kind of smoking, alcoholism, the drug abuse is far more commoner in men than women. So these are all like kind of unwanted coping mechanisms what people resort to. Whereas when stress remains unchecked and it goes on for a long time, the patient becomes more susceptible for heart attacks, diabetes, hypertension, strokes, and a whole lot of even cancers, because they say the immunity goes down to such a low level because of your stress factors. No, you could be susceptible to anything. You become more immunocompromised. So that is how important the role of stress is. Though stress is always undermined, especially in men, because there is a lot of stigma which is attached to mental health. Like whenever we are talking about mental health only, I'm sure that over the years that barrier has come down, because I still remember we would have a psychiatry or a psychology department completely separate from our normal general medicine thing, because like kind of whenever a person is going to the psychiatrist, then he's already branded that he's like mentally unstable, or there is something not so right with this person, or like kind of he's like half mad or like half crack or whatever it is. But I'm glad that over a period of time, psychiatry and psychology both have become so acceptable that like kind of people have understood that it's a need, and like kind of mental health awareness is there. It's not like when I was doing my post graduation, like kind of in the early no 2000s, like kind of when we were doing there, like kind of 20 years back, things were very different, but things have turned around for the good. When we talk about men is always associated with traditional masculinity. We have been seeing a lot of Hindi movies. I'm sure like kind of there's a topic on that which will be addressed, so I'm not going to like kind of go into that. We are always know there's a fear of judgment if you're sitting, you're going to a psychologist, or if you're going to the psychiatrist constantly and like kind of thing, you are like little worried what your peer circle would be no kind of talking about you and stuff like that. And then also there is a lack of awareness. Like we never think if the stress is going beyond a certain limit, we find coping mechanisms, like kind of going no going for a drink, or like kind of no going for a smoke, or like something like that. Like kind of these are not healthy coping mechanisms. So going and meeting a psychiatrist or a psychologist and no getting proper no, they'll guide you how to cope with stress, and that is the right way to go about it. And like again, talking about Bollywood, we all know this, no, mard ko dard nahi hota, which is like kind of just a notion, and I think this myth should be bust. And no, it's not that. Like kind of we only think no, we talk about women and child health. We do not talk about men's health. So I think it's nice that like kind of at least people are talking about men's health, and such myths should be no kind of these are not true things. No, these are just like kind of Hollywood or Bollywood stuff. So which is not like kind of which is not reflecting a true picture. No, just like kind of to summing up what stress is, like kind of we know stress is just a normal physiological response. Like kind of how we handle is very important. Stress could be acute, chronic, traumatic. We call something called as a post-traumatic stress disorder. That is like if at all you had a no accident, or like kind of some death in the family, there's a brief period of trauma which increases your stress factor tremendously. Stressors we have already discussed. Body response I've already told you, it's a fight or flight mechanism that triggers. But then if this energy does not get no properly utilized, there's a whole lot of abnormal stuff which happens. And then the long-term side effects also we have spoken about what stress can kind of no end up with, and if you're not taking care of your stress. Now briefly regarding diabetes, I'm sure like kind of like when we talk about diabetes, no, diabetic is a chronic metabolic disorder which is characterized by elevated blood sugar. Now, a person has a normal physiological blood sugar levels. So, in diabetic patients, the blood sugar levels are elevated above the physiological limits. Now, why this happens? This happens either because your body is not producing insulin, or the insulin which your body is not has produced is not working properly. So these are the two conditions generally why a person develops diabetes. Now, what is that? No, why are we so bothered about diabetes, and where did all this diabetes come into the whole webinar today? And like, why are we linking stress to diabetes? So if you're looking at India and diabetes, the China is the world capital of diabetes. Like India is like beating these numbers. No, like kind of we are in a close no combat like, to beat the numbers. And if you're looking at the sheer numbers, you could see in millions right now in India we are like kind of, that is 2019. We say 77 million patients, adult patients had diabetes, and by 2023, 1 in 10 Indian adult male will be a diabetic. Okay, so this is an alarming figures what we have, and these are only, mind you, the detected numbers. In a country like India, we have millions of patients who are not diagnosed. So actually, the recent ADA census says that like kind of by the year 2030, 1 in 7 adult in the Indian adult would be a diabetic. So that is how alarming the numbers are. It's a huge financial burden on the country, on the family, and like kind of the complications are immense. So I will not be going in detail about diabetes, but then one factor I want all of us to know is we as Indians are more prone to diabetes. Like, why is that? One is the ethnicity. Being born an Indian itself predisposes you to a risk of diabetes. So there are a couple of theories which I'm not going into the details. So what we call is, there are two very famous theories. One is the thrifty gene hypothesis. Thrifty gene hypothesis states that like kind of when we evolved, and like especially Indians, like kind of we didn't have a lot of calories. Like our ancestors were exposed to to survive with lesser calories, lesser food intake. So the body is evolved to survive with everything less. So anything less you give to the human body, it accepts well, and you're in a survival mode. But today we live in a calorie excess environment where your body is absolutely not able to handle that calorie excess, which manifests as metabolic syndrome, and diabetes is one such example. And other thing is like the Barker's hypothesis. That means like we all know Indian babies are smaller like compared to our Western counterparts. So if you're born small for weight, also you're born with a lesser pancreatic beta cell mass. Pancreatic beta cells are insulin producing cells. So that means like later on in life, the chances of your beta cell failure is more, because when you're born itself, you're born with a lesser beta cell mass. Family history, yes, if you have a family history, because diabetes is a polygenic disorder, the chances doubles up. And also there is a scary phenomenon which is called as phenomenon of anticipation. That is, if your grandfather was developed diabetes at 50, you will develop diabetes at 40, like your father will at 40, and you can develop it at 30 if you don't take care of your proper health. So when we're talking about the age, the problem with Indian men is the diabetes hits you at the most productive age group. That's like kind of, we are talking about 40 to 50 years of age. Like if you're looking at the Western counterparts, you're basically talking about diabetes happening much later, like kind of possibly after 60 years, 70 years. Here it affects us very early, and like which definitely has a huge burden on the whole family. Lifestyle, yes, we are not so physically active, and diet I'm not going to be dwelling, because we have another very qualified speaker on diet and nutrition who will be addressing that. But then one point I would want to make about diet is like kind of the amount of calories what we consume. In the Indian population, 70% of our caloric requirement is met by carbs, which is a very no bad thing for diabetes. When you are looking at any Western counterparts, it's always less than, it's around 50 to 55% carbs, and proteins and fat is like kind of constitutes for the other thing. But in Indian patients, almost 70 to 75% of our calorie requirement comes from carbs. The more carbs, the more problem you have with diabetes. Now, what is the link? like kind of why are we talking about stress and how can stress cause diabetes? So we all know that, like kind of I've already discussed about this stress, your fight and flight mechanism. So during your fight and flight mechanism, we basically, there are a lot of other mechanisms, but the main thing what we are talking about is cortisol and adrenaline. So what does this cortisol and adrenaline do to the human body? First thing is there is a hormone imbalance. Whenever there is a hormone imbalance, what happens to the liver is the liver will start producing glucose. There is your glycogen stores, the liver starts breaking down unnecessarily, and also there is gluconeogenesis, which is totally not necessary. And so, like, see, these are protective mechanisms. When you are in a state of starvation or when you're not getting enough sugars, that is when these mechanisms should happen. But whenever there is a cortisol and adrenal excess, like kind of these unwanted things happen, and unnecessarily the blood sugar rises. And also what happens is the insulin which is being produced cannot act properly because there is a lot of insulin resistance which happens. And also another important thing is the appetite goes for a toss. We all know that when you are stressed, there are two types of people. There is one group, or majority of the people want to eat. No, they feel like kind of that gratification by eating. They feel the stress temporarily goes down. There is another group of people who starve. So, but this eating group constitutes the majority, whereas the starving group is a minority. And then also your sleep disruption is there. So what about sleep disruption? We all know that the humans have a cortisol axis. So if at all in the night times after the sun goes down, your melatonin should come up and the body is preparing for sleep and the cortisol level goes down. So when the cortisol level goes down, like kind of the insulin sensitivity improves. So that is one of the most thing I would like to tell all the corporate men who are doing night duties. It is not a good thing for you. We are not nocturnal beings. So the more night duty you do, the more problem you are causing to yourself in the longer run. So diet, let us keep it aside. Sleep, definitely yes. If you are staying awake after 10:30 in the night till 3:30, 4 in the morning, unnecessarily you are landing up in trouble. If not, you're young, the body copes up, but if you keep doing it for a longer time, then we're going to have a lot of problems. Now, how do you manage stress and prevent diabetes? Like kind of this is one of my most favorite sayings. They say food is the most abused anxiety drug and exercise is the most underutilized antidepressant. So these two things, if we can get it right, most of the management is done. No, and mindfulness and meditation is something very, very important because unless you are mindful of what you are doing, you will only keep doing unwanted things. Physical activity is a must because we are not designed or we didn't evolve. The human body is not evolved to be sitting inside a closed chamber in front of the computer and doing night duties. No, as long as you are in sync with the nature and you respect the rules of the nature and you respect your body's cortisol axis, your health is going to be fine. And calorie excess is something which is we are very worried about because we no longer live in a calorie deficit environment. We all live in a calorie excess environment, and your body cannot handle anything which is excess. Even you don't eat for 2 days, you will still live. The body is not going to have any problem because most of us, for us, eating has become a conditional reflex. No, like kind of we eat by the clock. You don't listen to your body. So once the clock strikes, the lunch, breakfast thing, it goes around and it has become more of a habit rather than a need. Okay, so we eat to satisfy our taste buds rather than to meet the nutritional requirements of our body. So a couple of last slides, like kind of we have to prioritize our well-being. So this is something which is very important for men to know because we always go that extra mile, like kind of to keep everyone happy around us. But until and unless we are physically and mentally fit, you cannot keep anyone else happy. We'll have to set boundaries. We have to say no when no, you got to say no. And then we have to have some stress busters, some hobbies, exercise, or anything to take our minds off. Then practicing mindfulness, I've already told you. Now, this is one of the most important things what we have done. We have had open communication, active listening. So all that we are doing to cope up with the stress. And we have to have a network where we have health professional support group. That's exactly what we are doing. And this is one of the very good apps what I've come across, like kind of this is my last slide. This app is by Varun Medappa and team who lives in the US. So normally what happens is I would want to put this person across to Dr. Sushma also to see how they can work together. So this is an app. Like I'll just take this. If you want, you can take a screenshot. So what it does is generally we know we calorie counting becomes very difficult. So you go to a dietitian, she'll give you a diet chart, she'll tell you this much percentage of the portion should be carbs, this is your kilo, this is your total caloric requirement, so much should come from protein, so much should come from carbs. So how are you going to do that? So this app you just download. Whenever you eat, you set your caloric requirement and you just take a photograph. So once you've taken the photograph, it will upload and it will give just your plate photograph of the meal. If you take roughly, they're still working on it. It is AI aided. It is beautiful. It might not be 100% accurate, but then their accuracy is improving with the newer and newer data what they're getting in. But at the end of the day, it would have told you how much kilocalories you have consumed, how much percentage comes from protein, how much percentage comes from carbs, how much fibers, and how much fat you're getting it from. It's an amazing app. I was really impressed by it, and I think this is of a practical utility because diabetes is incomplete without a proper diet. No, the main stand of treatment of diabetes is diet. So, having said this, like kind of I would like to sum up my talk. I think it's very important that we talk about men's health. We have spoken enough about women and child. It's also time we address men and their well-being, because like Avinka Mandar has already told, now there is no men, women and all that. So we are not talking, we were always talking about women's rights and stuff like that. Now we live in a world which is having equal opportunities, and like no, everyone is no capable of doing whatever it is. It is not like the traditional thought process where men is the breadwinner and women is the no kind of homemaker. So I think it's we are no really at it. We are doing a good job, and thank you, Elo for giving me this opportunity. And I would no like to be associated with you and see what best we can do in the future to address men's health. Thank you.
It is our absolute pleasure to have you. So we offer our thanks to you. Okay. So, sir, while you were explaining about the various aspects of stress, so many concepts like psychoneuroimmunology, how cortisol affects your entire immune system responses, and it is not the amount of sugar you eat, it's the amount of stress and sugar that causes diabetes. But yes, you should moderate sugar as well. So I could really see how you could take you brought that psychological sensitivity into explaining things which typically lacks in the medical setting. So it has been a very big, huge pleasure for us to have heard from you. So thank you again, Dr. Amrut.